Alright, so we're going to be belting up a patient for lumbar decompression. How you been doing?
Great.
Good.
You?
Can't complain too much. Have you been using your, still training
Yep.
post-therapy?
Yep.
How many days a week?
3 days a week with a trainer, and then I work out on my own. So
How's golf?
golf has been going great, knock on wood. I'm 5 weeks in, been playing 3 days a week, and no issues.
Excellent. So a couple of months ago, what were you faced with?
Surgery. And,
So several months ago, you were faced with surgery.
6 months of rest and rehab, and then start limited sports activities, and probably another 6 months before I'd really be back 100%.
So you had some lumbar injections as well, correct?
Yeah, 4.
So 4 lumbar injections were faced with
shots.
Faced with a surgery, and you were very, very diligent, consistent with doing decompression 3 times a week, and now you're playing golf. Now you're not faced with surgery.
So yeah, I mean, 2 things. I'm back. Probably about 8 to 10 months sooner than I would have been with surgery, and I didn't have surgery. So
Fantastic.
if I wasn't stupid, I may have been back sooner. But as you know, I started feeling better in the fall and went back to playing paddle tennis a little early. Had a relapse. That's when I had my 4th cortisone shot, and that's when I decided I got to get the surgery, right? And but continued the rehab, continued working with you, and went for my pre-op MRI, and the MRI showed significant healing from the June MRI. So that was a January MRI versus June. And basically the severe herniation that I had, which, this big blob of stuff that was sitting up against 2 nerves, was
Resolved, healed.
well, it was now a bulging disc with a minor herniation. So we continued from January on, and I'm still here with you and doing maintenance now, basically, right?
Correct.
And I imagine if I had an MRI now, that bulge is probably even lesser than it was, and that herniation is completely gone. Because I don't think I'd be playing golf the way I am if that was still there.
You definitely would not. Arch your back for me.
One doctor took a look at the MRI, the comparative June to January, said in 30 years, this is the 3rd time I've seen healing like that.
There you go. 30 years.
Awesome.
So let's have you shimmy down a little bit. There we go. Very good. So when people see this contraption and all these belts and levers and lights, and that's nothing for the patient to be concerned about. How does the therapy feel when you're on it?
Oh, it's torture. Couldn't be any worse. But come on, you see me in here, Dr. Time. I'm half the time I fall asleep on the machine. But, so it's there's no pain whatsoever. If anything, it feels great.
So we're going to stay at the same level that we've been at? Yeah, because we had really good success with that.
Good,
We're not going to increase it. Good. So, lumbar decompression. Good morning, Essie. Lumbar decompression, how it works. This cord pulls with a calculated amount of poundage based upon his body weight. We want to get to half of the patient's body weight. We don't do half the body weight day 1. As you can see, the cord is starting to pull and starting to move. tension and slack is going to be taken up in the belt. Once all that tension and slack has been taken up, we'll actually start to see his body physically move down. We also help to tilt just a little bit. There we go. Tilt that pelvis to get into the optimal position. Very good. Therapy puts a specific amount of force at a specific disc level. So if you have an MRI and we know the level of herniation or injury or bulge or stenosis that is occurring in the spine, we can angle the cord to put a specific amount of negative force into that particular disc level. And once we're at the optimum level and all the slack is taken up, we now unlock the brake in the table, and now decompression is occurring. All that force is going specifically to the injured discs in the low back. When that pressure comes off the disc, no more shooting pain down the buttocks, down the leg, and into the foot. Patient relaxes on the table for 28 minutes, no pain, no discomfort. It's finally the first time they get a chance to be without pain for a while. How the therapy works is going to pull up, it's going to pull at the calculated amount. So for argument's sake, let's say it's 100 pounds. It's going to pull to 100 pounds, hold for a minute, and then relax back down to 50. Stay for 30 seconds. Pull back up to 100, and it does that for 25 to 28 minutes. So there's a constant changing of pressure in the patient's body, so that there's no spasms, that there's no negative side effects, that there's no irritation to the disc. If you just take a disc and pull it and stretch it and don't give it a rest, you'll irritate it. So it's specifically designed so that does not happen. It's time for the patient to relax. Thank you, sir. If you need me, buzz me.
You got it.